Please chat in your guesses here. Do you see any findings? I know this is a abdominal radiology group, but yes, we got it. Everyone got it. Good. Pneumothorax, massive pneumo, large pneumo. Good. So this was a young patient, a young woman, and she had a pneumothorax. She had no prior medical history. So we really didn't know why she had a pneumo. You can see here on the chest CT, she still has, so they put in a chest tube and they got this chest CT. And here's the little chest tube. And you can see that there's some thickening here, and there's nodules here, which we could see better on some of the other views. And DT Trident already got it. So this was endometriosis and the catamenial pneumothorax. Good, awesome. Lots of people are getting it. So yes, she was a young woman and this was endometriosis. So does anyone know why you get this usually at the right lung base? I actually already flashed you guys the answer, but it's because of the peritoneal fluid flow, and this influences the distribution of endometriotic lesions. Exactly, so D Trident is saying implants in the liver diaphragm. So this was a couple of images from that paper, but basically there's all these ligaments in the abdomen, and the peritoneum has cyclical flow, and it flows in certain directions. And so, for example, in the right upper quadrant, the peritoneal fluid can flow up here and get trapped between the liver and the diaphragm. And then there's fenestrations in the right hemidiaphragm that allow the endometriosis implants to cross the diaphragm. So when you have a catamenial pneumothorax and endometriosis, it usually goes to the right lung base. On the left side, the frontocolic ligament actually protects the left lung base. So any of these implants can't usually get above the spleen unless the patient has had prior surgery, like a HIPEC or something. Other places where there's stagnation is in the right lower quadrant. So between the mesentery of the SMA and SMV and in the infracolic space here, this is another place. So this diagram actually shows you these areas of stagnation. So one area where peritoneal fluid can flow and get stuck is on the terminal ileum and cecum. And actually, I think that applies to Rupa's case from a couple of weeks ago, where she showed that big endometriosis implant on the terminal ileum that was mimicking a small bowel mass. Other places where there's stagnation is on the sigmoid colon, so you can see endometriosis there. And of course, in the cul-de-sac, because especially as you're lying down, that's going to be the most dependent area and where a lot of the pelvic fluid accumulates. Steve is saying similar distribution for ovarian cancer. Yep, exactly. I always thought maybe the lung part was hematogenous spread. I didn't realize that our diaphragms have fenestrations in them that endometriosis implants can cross through.